Good question came in. Again, welcome to Ask Dr. Pane. This one is, when can I get a revision of a tummy tuck? And the person describes a tummy tuck and liposuction done a year ago, and they still have loose skin and they are not flat. Well, it's a little hard for me to comment specifically. The picture, as I'll describe it, is a relatively flat abdomen with some loose skin at the upper part. Not really a skin panus hanging down, but they have an up and down scar where the old belly button used to be. So somebody moved it down a couple of centimeters, and they're not really flat, but they don't have a lot of loose skin. So I'm not exactly sure what they looked like before. I think this case could be improved, but it would probably require, in my hands, I would serve you best by doing a full abdominoplasty. You've already got the scar there. I would flatten the abdomen more and get that defect down as close as I can to get it out. Now, because there's already an up and down scar left and the belly button defect, I don't recommend floating the belly button down in this case. I would just redo the abdominoplasty, I like to think the proper way, and get it flatter. There's going to be a little up and down scar left over, probably because the defect that's already there probably cannot be advanced all the way down, but you would have to individualize that at the time. So I think the abdomen can be notably enhanced. I don't know if tightening of the musculature was done and why the skin is uneven. There can be a couple of reasons for that. You'd need to be examined in person to make sure we kind of see what's happening with the abdominal wall. But with tummy tucks, and when they don't get the belly button defect all the way out, especially leaving it as high as it was in this case, I'm not sure who did that first tummy tuck or how experienced they are. That is an unusual result for what I would expect to see, for most of my skilled colleagues. If one of their patients had come in after an abdominoplasty, I would expect to see it a little better looking than what I saw on that picture. But that being said, I don't know what they looked like, before the first operation, so I got to qualify my comments. An in-person exam and then a good plan to get an improvement here. I think an improvement could be achieved essentially 100%, and hopefully it will satisfy this person's aesthetic goals. So again, revision tummy tuck a year out, plenty of time, individualize the plan, in-person exam, and we would go from there. So I hope that helps, and we will talk to you on the next question.